The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, your host today. And today we have Kristina Liu, who is not only the radio show producer, but is co-hosting today. And of course, also runs the Talk of the Town segment that will be coming a little bit later in the program. Otto Los is not here today, who is our permanent co-host. He's
golfing in Sleepy Hollow. The nerve of Otto.
Yes. Yeah, well, I don't know who authorized that, but we will definitely miss Otto. Kristina, of course, pulls these shows together every week for the last 12 years and bringing in really wonderful guests. And today is no different. We have Shannon Prasad and Bill White, both from Northwell Health at home. So we're so happy to have you both here. Shannon, you're Director of Operations, and Bill is a Senior Director over there. And we'll get a little bit more into detail about the program and what we're going to be talking. But first of all, thank you so much for joining us today. We're so happy to have you. Northwell is our partner on so many levels for, since Project Independence came to be. So this is just kind of a natural fit. So one of the things I was thinking of about home care is not a lot of people make assumptions. I mean, we're all in the business, so we know the role of home care, the different ways home care could assist people. But I think when seniors or a lot of people think of home care, they think of someone maybe who is possibly convalescing at home after a major injury and may need some kind of aid for the, for a length of time. But Northwell Health at home offers so many amazing different things. So could you just go a little bit into what home care really is, and that it's so much more than having somebody come to the house a few hours a day. I mean, it's endless, basically.
Really? Yes.
Yeah. Thank you for having us. We really appreciate it, and any opportunity we have to answer questions or educate the community, because I think there is a lot of confusion as far as what home care is. It's a very kind of nebulous term. And there's a lot of, talking now as it relates to providing these services outside the walls of a hospital. So Northwell, is really uniquely positioned as a health system because they have their own post-acute division. But we really rebranded that name to continuing care, because we realize that we're providing care based on where the patients are. So it doesn't require someone to have to be in a hospital, coming home from a hospital in order to get home care services. And we have developed different lines to really meet all of the needs. And really what the driver is, most of the services are provided by insurance. And it's really about, meeting the eligibility for the various things that, services that are needed. So in a nutshell, when you use the word home care, there is something called a certified home health agency, or a CHA. And that's what one of the services Northwell provides. And that's probably the service that is most familiar to people, because they're receiving these services most of the time after they are hospitalized, and they're seeing a registered nurse or a physical therapist in their home shortly after they leave a hospital. So that's probably the most common service that people are familiar with. But the other things that we are providing in the home is we're providing home infusion services. We're providing rehab only services as an alternative to someone going to an outpatient center. So that's a different service. We're offering hospice services, and we're also offering home health aid services, which is really Shannon's area of expertise. So when you mentioned earlier, when in the introduction about an aid, there is a lot of demand for that. When we're really trying to support the principles of Project Independence and helping support people to be able to age in place. A lot of times in the world we live in today, family members are dispersed. So, whereas, maybe in the previous generation, your son and daughter lived, down the block, or, in the basement apartment, now people are, all over the country. So now we have, folks that are living at home, trying to age in place and, living in those 2 or 3-story walk-ups. And as they age, it's getting a little harder to get up to that second floor, or, to prepare meals, or to do the basic things that really someone needs to do when they own a home. So being able to get that level of support in the home is something we've identified as a need, and we definitely can support. So that's, from a home health aid standpoint, a very popular service offering. And certainly let Shannon explain a little bit more details on that.
Sure. And again, thank you so much for having us today. It's a pleasure to be here and a true privilege to be here too. Anytime that we get a chance to speak to the community, we're grateful for that. And we are really here to serve the community. And we recognize that, and it's very true, that spectrum of home health aid services or home care services is very broad, in the sense that we really, we serve individuals that have minimal needs, extremely, and some of it could even just really be checking in on the person, making sure they're okay, whether they've had a recent loss and that person is, or they've had a recent change in their condition and they just kind of need somebody to come in a few times a week and check in and make sure that they're doing all right, through the person that needs constant care and significant care, where what we would say is total care, where they need a Hoyer lift. They're unable to transfer out of bed independently. They need to be turned in position every 2 hours to make sure that their skin doesn't break down and they don't wind up with a wound that could be, unfortunately deadly if they're not properly cared for at home. So the spectrum is quite broad. And we love to get connected with patients early on, so we can keep them independent for as long as possible. So we recognize, your home is your home. That's your safety net. A lot of times people feel, if I could just get home, I would be that much stronger. So we are that vehicle to help get them back home, return back to the food they like, because we all know how we love our food, and just being in their home environment. But in doing that, we do make sure that all the disciplines do come in to make sure that they're safe at home. If recommendations need to be made, modifications to the home, whatever it is, to really try to keep them as safe as possible. The teachings to the patient, as well as to any other potential family member or caregiver in the home, as to how to further educate them, how to care for their loved ones when we're not directly there. So those are all the important factors. We also do have social workers that will come in, if insurance will approve it, terrific, or if it's under private pay, if they'll pay for the service, where social workers can come in and make recommendations also. And as Bill pointed out, I guess a good and bad thing is that we're all working so hard that oftentimes family members can't be there. And it's not that they don't want to be there, they just can't, because it's a struggle to be there. So social workers, geriatric care managers can be hired in order to be involved in the care team and just assure that they're safe, whether it's some of the simple functions from going through their mail, assisting them with paying bills.
I was going to ask, because a lot of people that are listening may not be familiar with different terms and things like that. So a geriatric care manager, can you just kind of explain that role?
Sure. For us, and it can be a little bit different depending on, who you are. For us, we have 2 social workers right now that do the geriatric care management, and what they do, and what they kind of explain themselves as being, is almost like the surrogate daughter, where they will oversee. They will take care of, they'll go to doctor's appointments, and it's not supposed to be specific to daughter, son, daughter, daughter-in-law, son-in-law, whomever, where they don't have that family member that can be readily available to kind of just oversee how they're doing, help them, like I was saying, doctor's appointments, or if they need assistance with shopping, if they need, even if they do need that transition where they're not appropriate to be at home anymore and they need some help in finding out what resources are out there. Our intention is to keep people at home as safe, in a safe manner as long as they can. But if it is identified that this is just not what they want, they'd rather be in a congregate setting, then we're going to help the patients no matter what. And if that means transitioning them into assisted living, independent living, whatever is appropriate for them, they will assist in that manner as well.
Gotcha.
Shannon, as a geriatric care manager, is it sometimes covered by insurance, or is that service tend to be, out of pocket?
There is in certain clauses of long-term care insurance, sometimes it can be utilized in their policy. If they have long-term care insurance, you have to dig through and vet the policy to see what's in there, which is something that we will do. We do accept also on the home health aid side, long-term care insurance. So we'll always contact the insurance company with the appropriate representative, meaning if there is a power of attorney and the long-term care insurance company has that person listed as an approved representative, an authorized representative, we will do a three-way call to verify the benefits and coverage. What's always important to us, we don't want any financial surprises. We want to make sure that our patients fully are aware if there are going to be any cost associated with the care that we're providing, that they're aware of it before we begin.
Right. I'm going to jump around a little bit, so I hope you don't mind. I love the rehabilitation at home. I know what it's like for somebody who has to go to a rehab 3 or 4 times a week, getting in the car, I'm curious to what level of rehab do you do at home? Would you be doing something where someone who has to go for maybe a hip replacement, who has to continually go, would that be something Northwell at home would do?
Yeah, that's a great question, Rebecca. So, and it's so funny you mentioned hip replacements because, joint replacement, the whole process has shifted so dramatically in the past 5 years. So if you look back, 5 years ago, the traditional trajectory for someone getting their hip replaced would be they meet with a surgeon, have a dialogue, kind of set the expectation as to what was going to happen. The patient would come into the hospital, have their surgery, maybe spend 2 or 3 days, if not more, in the hospital, and then transition to a subacute rehab. Right. They might be in a subacute rehab for several weeks, and then transition, eventually home with recommendation either for home care services, so in-home therapy, or maybe a recommendation for an outpatient, physical therapy. The surgery, the way the surgery is done now, and just the advances have changed so dramatically, so that we have patients now, and we're talking about, not the 50-year-old. We're talking, patients that are even older that are able to go in the morning for for a surgery and receive physical therapy later that afternoon in their home.
Wow.
I mean, it's absolutely remarkable. So to answer your question is, Northwell actually has developed a program in working with our orthopedic service line to really fine tune this process. So making sure that the patient, does have the right level of support in place. Right. When they do arrive home, they're seen either the same day or next day by a physical therapist, so that they can start to work with range of motion exercises, home safety, educating on, how to navigate, in a home, up and down stairs, making sure they're safely getting to and from the bathroom, assembling any durable medical equipment that, would be sent home with the patient, like a rolling walker. It's remarkable what people can do with the right level of medications and the support, that's in place. And then what ends up happening is typically, a patient would be receiving that in-home therapy until they're ready to kind of graduate to the next level. So when you go to an outpatient physical therapy, you're now working, with, machines and equipment that really help you kind of, even, get back to that prior level of functioning even faster. So, the idea is that, we do offer outpatient physical therapy within the Northwell system, but, you just have to drive down the block and you can probably bump into 5 or 6 of them, probably within a 2-block radius of your home. So, but Northwell does offer that service as an outpatient through our STARS, sports therapy and rehabilitation services. But we did find during COVID, especially, patients that were fearful of, being in a congregate setting, that they prefer to actually have that, service provided in a home setting. So after home care is finished, which it can be physical therapy, can be nursing, can be a home health aide, usually covered under the Medicare benefit for all of those services. They're ready to graduate to the next level, and they could potentially go to outpatient physical therapy. But they said, you know what, I'd really like to have that, continue in the home. So we've taken the patient really kind of the level where they can go with home care services, but they might be able to have a outpatient trained physical therapist still come to their home. They bill a different part of Medicare. They bill Medicare Part B, similar to what you would bill when you go to an outpatient rehab facility. And then you're getting kind of more of a frequency of visits, usually, 3 times a week, for a few more weeks. So it's really for those patients that really would prefer not to go to outpatient because, as you mentioned, maybe transportation can be a little challenging or, just personal preferences. So that is one option. But, what we have, and as we started off the call, is, we've really identified, each segment along the way on the services, based on the patient's needs. So it's not a one size fits all, and it's really tailored to what the patient's needs and want.
Gotcha. Okay, that's great. That's, really great. And, of course, I'm sure there are patients who, for whatever reason, might require multiple services. Maybe it's a cardiac patient who's also recovering from something, an illness. So I'm sure, is that where the geriatric care manager would come in?
Yeah, because that's the same question I was having, Becky. I
Right.
mean, there's so many services you all provide that I was wondering, what is the process of it? Walk us through, a senior calls and then then what happens?
Okay.
Well,
Go
yeah,
ahead, Bill.
typically that patient, that medically complex patient, might be taking advantage of, several of our services that, provided through Northwell Health at Home. So let's just take, you mentioned, that heart failure patient. So, with a heart failure patient now that's going home, that might be going on an IV antibiotic, so you're like, well, I have to wait till that finishes in the hospital before I can go home. Well, the reality is that those services can be provided in a home setting. So depending on where the patient is coming from, if it's coming from a hospital, there's a case manager in the hospital that's setting up those services prior to discharge.
We have to take a quick break, Bill. So we're going to come back to the case manager because now we've got the geriatric care manager. We want to just keep everything going. This is great. We're getting a lot of great information. You're listening to Project Independence and You Community Talk Radio on 88.1 FM and WCWP.org. We'll be right back after a quick break.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence and You Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, of course, along with Kristina Liu and Dan Cox. And today we're speaking with Shannon Prasad and Bill White from Northwell Health at Home and getting a lot of information on the services. There's so many, but just before break, Bill, you were going into really good detail about, kind of where does the geriatric care manager, case manager, how does that all fit in? And we were, you were just giving us a really, really good background information. So please continue.
Yeah, absolutely. So, trying to figure out which services, someone needs is really the responsibility. These are physician ordered services. So, if someone's coming out of a hospital, they're working with the discharge planners at the hospital. So that could be a nurse case manager or a social worker in the hospital setting. If they are needing those services but aren't coming in a hospital, then they're working with their, community physician or specialist, such as a cardiologist, to get connected to the services that are needed. But you brought up before break the medically complex patient that might have heart failure, that is coming out of a hospital, that might need multiple services. So they might need a registered nurse or physical therapist to come to the home to help them learn how to take a new medication that was prescribed, to really monitor the effectiveness of that medication. Like heart failure is a great example. Like Entresto is one of the very popular medications prescribed for patients that are newly diagnosed with heart failure or have advanced heart failure. But that's not a medication like aspirin where you just take it and, and all of a sudden it, clears up the problem. It helps manage the condition, but you really need the help of a nurse to really kind of monitor the effectiveness, to really be able to teach on some of the early signs and symptoms when maybe the medication needs to be adjusted. So we be in communication, with the patient's physician. They might need other services as well. Like, while we're in there, they might identify a need for, maybe an infection, that, is developing or developed, and maybe they need home infusion services. There are certain cardiac conditions that actually require patients to actually have, continuous infusion. When you have advanced heart failure, there's a drug called milrinone, which is administered through IV, like a pump. So, that's something that we provide in the home setting. So it's really being able to, have, an understanding of what services are needed. The physician is great, with identifying, what services, could be provided in a home setting, and then they order those services. We had mentioned also a geriatric care manager. So that really isn't about clinically determining which services are appropriate, but it's really more on a social level on determining, what a person needs to be able to age, in a home setting. Like, what are they needing? Are they needing to be connected to, Meals on Wheels? Has it gotten to the point where, maybe someone's wheelchair bound and now they have no easy way to get in and out of their home, but they need access to, maybe a community home improvement, contractor, or some services in the community that are offered to seniors at a low cost or no cost. So how do you figure all of that out? Most of us, will, kind of go through the internet and start typing away, but maybe you really need someone with the expertise to, kind of make sense of that world. So that's kind of where the, geriatric care manager, comes in. For the most part, it's a fee-based service. But, there are, as Shannon mentioned earlier, some long-term care policies that will cover that. And when a patient's on home care services, receiving that nursing or physical therapy in the home, especially after, a recent hospitalization, those there is a component where we do offer social work services, in conjunction with those other services, but they don't exist by themselves. So they're usually an array of services that are offered simultaneously. So as I'm explaining this to you, I realize it probably, gets a little overwhelming and complicated. And, our goal is just to try to help kind of reduce the confusion. And because we have so many different services that meet the different needs of the, of the patients and caregivers, we want to help kind of direct them. And that's, really the role that we provide at Northwell, is just to try to help direct people to the right level of care. Based on what
I
they
think
want.
now would be a really good time too for those listening to, I know you have an 866 phone number, a number that people could call if they have any questions, but I also want people to know, especially those listening living in North Hempstead, they can always call 311 or 516-869-6311, which is the town's 311 call center. Ask for Project Independence. We can absolutely help connect to Northwell Health at Home. I mean, on so many levels, we're partners, so that's a good way. But there are ways to get in touch with you all directly. So why don't you share that with our listeners now? The 866 number.
Yeah. So, Shannon, did you want to provide your number, or how do they reach out in
Sure.
terms of?
Sure. So two different ways. Just general information, which it's what we would say is our community desk if individuals are calling into. It's that 866-651-4200. That's really if the community has any questions about care at all, whatever it may be, and they simply need a resource. That's a common number to utilize. If they were looking for home care, specific for our home health aid, and just and thank you for the opportunity, because I just wanted to expand a little bit on the home health aid and the process, and thinking about that patient that they're at home and they don't know where to begin. To your
Right.
point, is simply just calling our 516-266-5200 number. Can always ask for me. Again, I'm Shannon Prasad. And just to and what I do is speak to families all day long, patients themselves, if they want to speak directly to me, and just get a sense of what they're looking for. And the process is, just to go over, we only utilize home health aides because there's companions, personal care aides, and home health aides. And home health aides have the greatest training out of the three. It doesn't mean that we wouldn't place a home health aide for somebody that maybe just needs a companion. We would, but the importance is that they have the skill set that if it gets to the point where the patient, their illness advances, and they do need the hands-on care, the person that we have sent in has the proper training. So we don't have to make the change based on if their illness advances or if they decline. So home health aides can assist with bathing, dressing, toileting. They can assist them with ambulation, so helping them get around the home. And sometimes that's what it is. It's going and just making sure that they get around safely. They can assist them with transferring, so helping them out of bed, out of a chair. The personal care is that hands-on care is what is always so important, as well as meal preparation and light housekeeping. So that's really the scope of practice.
Mhm.
What happens is we being a licensed agency, we are regulated by the Department of Health. We have 48 hours. However, we always do it in 24 hours to send a nurse to the home to also do an assessment. And when the assessment is done, the nurse is also creating the plan of care. And the plan of care is specific to that individual. And it's specifying what should be done for that period of time in which we're providing the care, the tasks that should be completed. And I always say it's as simple as, let's take a female patient that maybe she wants to be bathed every day, but she doesn't want her hair washed every day. It'll be indicated on the plan of care, just wash the patient's hair twice a week. Please don't do it 7 days a week. So it's just an example. The aides are insured and bonded. Being a licensed agency, we do a complete background check. We do verify their certificate to confirm that they have the appropriate training, which is maintained in a central portal. We make sure they go through a thorough interview process, so they're fully vetted and their medical file is up to date. And like I said, a complete background check is done, including fingerprinting as well. So, and they are Northwell employees that come into the home. So they go through that same tough process that Bill and I had to go through as well in order to
Right.
come
Yeah.
and be part of our team. And that's how we approach it. And just to kind of touch on a little bit more, Northwell consistently uses the term team, and it is a team approach. We always want patients or caregivers to call us with ease. You contact us, and it's our job to figure it out. It's overwhelming enough, just the concept of saying, I'm going to welcome somebody in my home. Let me figure out the insurance, let me coordinate with Bill, and we'll figure out what's best for the patient.
There's so much things I'm just reading through, the pamphlets and the programs. There's also lab services that could come to one's home, which is just
Yes.
another,
Right.
I would say convenience for an older person, someone getting well that has to go out and, now take a fasting test somewhere. How does that work, and how is that all determined?
Well,
Could it just be someone who maybe is like a diabetic, person who's, otherwise can get around? Like, is there that kind of service that just needs, testing frequently? I'm just pulling something from there.
No,
Or
that makes sense. So Northwell, one of the advantages again as a health system is, we have our own laboratory services. So, and during COVID, I think that became kind of front and center of how many COVID tests we were processing, on a daily basis. So, critically important, for our health system to be able to, adjust and, and meet the needs of our patients. So, one of the services we do have is we have patient access centers. So somebody that needs, for example, a full blood panel and their doctor gives them a prescription to go get that filled. We have over, I think, 30 patient access centers for someone to go to for a blood test. But as you mentioned earlier, is that if they prefer to have that service provided in a home setting, we do have a program called LabFly, which is an app-based program where they can, where the patient or caregiver can upload that prescription and send it over, and then arrange for a home phlebotomist to come to the home. Now, there is a slight charge. I mean, the actual test itself is usually covered by the patient's insurance, but the trip to the home is a nominal cost. I don't know what they're currently charging, but it used to be like between like $20 and $30 for the home visit. But it does, as you mentioned, it's it could be a lifesaver for somebody that to have to get on a bus or to arrange public transportation to get out to a facility. So being able to provide that service in a home setting is just another advantage. So and that's through Northwell's lab service, and the program is called LabFly.
especially in today's day and age where, we're post-COVID or whatever we're called now. And, people still like to be safer and not have to sit in a room with people getting tests in a lab for, some people could be healthy and some people could be looking for, conditions. So it's I'm sure that our listeners now and people watching us also are like, their ears, this is a great service. This is something. I mean, I'm thinking like of my mother and how things would be convenient for her and what she's going through. I mean, she's, very in great shape and everything, but, has ebbs and flows, and some of these services would definitely make me feel better than knowing if she got in a car at the early morning to have to take a test somewhere down the road. But it's really, really great. And I know that you touched on it a little bit, from palliative care to hospice care as well. And to have all these services, and at one point, I mean, I think we all have to look at these services and just to go the whole range and be familiar with these, with Northwell Health at Home is, it is, I don't know, comforting in a lot of ways. So, I have to bring this up, and I know that, because it's like a dagger, long-term health care, so few people, long-term health insurance, I should say, are lucky enough. I know my mom has it, and other relatives have it, and it's, and if you never use it, it's so expensive. I mean, it's so, and she's had it forever.
I always encourage people to use it when you start to feel
right. Right.
Yeah.
So I'm curious, I don't even know, this is just something I think about, because this is the generation, and, our population is getting older. I'm assuming that there's less and less people carrying the long-term health insurance as we kind of know it from the past.
Yeah.
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 So
Absolutely.
And unfortunately, it seems to be, when they need the services the most, it's now they're going through the education process to understand, what their insurance covers for. And I think there's a lot of assumptions on, what Medicare does and doesn't cover. And if you go to the, the Medicare website or get the, booklet that comes in the mail every year, if you're enrolled in the Medicare program, and it tells you, what services, But the reality is that, many of these services, including the, home health aides, is not covered under a straight Medicare benefit. Medicare does not provide custodial services for the most part. And that's often a lot of the requests that come in, um, I'm calling in, my mom needs, an aide. She's, having frequent falls in the home. She lives alone, but, is insistent she doesn't want to move to an assisted living. And, I'm worried about her and, what services are available. So it's challenging because you really need to, just like with everything else, educate, understand, have a understanding of what, your insurance covers. If you have a Medicare Advantage plan like United Healthcare, there are some benefits and there's some, restrictions. So really being knowledgeable about what those services, and that's also kind of where the geriatric care management services can weigh in, is that, they're experts on understanding all of this. And, the Medicaid process, which is a very complex, slippery slope to go down, in terms of understanding. There are some benefits of, being qualified for Medicaid, because under the Medicaid program, under a managed long-term care program, they do provide home health aides, but the qualification process for Medicaid is quite complex. Definitely needs some assistance either through social work or an elder care attorney to get to that, to navigate those waters. And certainly, it is something that we find more and more people reaching out to us in their time of need, trying to figure all these things out. And unfortunately, not as many people have those long-term care, policies that, we would love to see. And I know Shannon has to deal with this on a daily basis, it seems like. So.
Yeah.
Okay, actually, my next question, when we come back, we have to take a quick break. You're listening to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. We'll be back with Shannon Prasad and Bill White from Northwell Health at Home.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Kristina Liu and, of course, Dan Cox. And our guests today are Shannon Prasad and Bill White from Northwell Health at Home. And we're just learning about, the wide range of services that are provided by Northwell Health at Home. And it really, it's the whole gamut. It's like lab services, through to hospice care. So, how long has Northwell Health at Home been in action, and how have you seen the growth? Because I'm assuming that you're doing more and more, and how just kind of give us a little bit of history.
Yeah, we've been providing certified home health agency services for almost 40 years on Long Island. And as Northwell, as an organization, has grown, so has our home care agencies. So we've expanded through acquisition, and as the hospitals acquire or bring on new hospitals within their system. We're, inheriting, legacy home care agencies and then merging them into our operation. And as you mentioned, we also have infusion services, which we've been offering, for many years. Hospice services. I think on Long Island, the name Hospice Care Network is probably more familiar to many people. We offer home hospice, services, again, for well over 30 years. We also have an inpatient hospice facility in Melville. And, there are, situations from, where people do need to have an inpatient hospice stay. But the reality is that most, patients and family members tell us that this is a place where they want to really kind of end of life to be is in their home. So we try to support that as much as we can. And the service has been phenomenal. We actually, I'm kind of glad you mentioned this, because we had a situation that kind of highlights the benefits of the Northwell continuum over the weekend. So we had a patient that was receiving home care services after a recent hospitalization. The family had a consult in the hospital about hospice services, and their family member definitely qualified, but they weren't quite ready for that, that decision yet. So we continued to provide home care services after they were discharged home with home care services. But over the weekend, we got a sense that, things were kind of trending in a direction, and they really didn't want to take their family member back to a hospital. They wanted to, really just, have, manage the symptoms in a home setting, really wanted to keep her home, but we're a little overwhelmed. So they reached out, and we were able to seamlessly transition that patient from home care services to hospice services in a matter of a few hours. So we were able to get a hospice nurse into the home that evening. We were, seamlessly able to kind of take over the care, because, we were transitioning from our home care service to our hospice services. And I got a wonderful note from the family on Monday that, really, just expressed their gratitude for helping that transition. They didn't have to figure all of these things out on their own. They felt like, that, their wishes, their family's wishes were being honored, and that the decision was theirs. They made it when they were ready.
Yeah, it's sad, but it's so nice that that was able to happen, because like you were kind of touching on before, sometimes we don't plan, like with long-term healthcare insurance, we don't plan, and you're in a situation and you don't know what to do. And it's like when you're, which is the worst time to figure it out, is when you're in this, urgent situation where you need healthcare, you need something, and you don't know what to do. So,
and I think it gets complicated, right? I mean, listen, we're all like in the business, so we kind of get a gist. But I even know, for myself, even like being on the show and having these guests, talk about these important services. I mean, I know my own family. It's like, what do we do? How do we get this? How do we arrange this? What's the next step? And I think a lot of times people just get overwhelmed and just say, forget it. I'm not gonna like go down this road. It's easier to just like not. So by having this kind of in the home, you're able to have access to services that you probably would never use if you were going to the place. So it's just so, I'm sitting here just, I mean, my paper is just, got all kinds of stuff, but I think it really is. And you highlighted it so well, Bill, because it is, especially, we've all been there with different family members, and you were just, at a loss, especially when things are happening fast. And the fact that you were able to kind of have that turnaround in just a few hours is such a blessing. It really is.
And Kristina, and to your point, that this happens to us as well. Even our team members, Bill and I have relied on each other personally in our own situations, because when you're in it and you're in that mode, in that crisis mode, it is very difficult to figure it out. And that's why I can only stress to the community to just reach out to us and call us, because we have personally been through it too, where you just completely, it's everything and you've been taught, and what you do on a daily basis as if it goes right out the window. And Bill and I serve countless clinicians' families, and the same thing happens to them. They may be running a hospital, but when it comes to this is when we take over with confidence and put ease to the situation. And that's what we really want to do for the community at large. And, this is what we're here for. And we've done it for each other. And again, that's why we always say we're a team, and our fellow teammates. And it'll say, have another Northwell employee, we got another, the Northwell family. It's something that we continuously say, and we mean it, because we've all been there, and it's painful and it's scary. So we want to ease that concern.
Right, because you could be the best planner in the world and have every angle, but when it's personal and it's emotional, everything is out the window at that point.
Right out the window.
It's like, wait, what do I do for a living? No, everything just goes. So some of home care where it's kind of like a longer term, maybe palliative care or other kinds of services that you provide. Is there like any way that you connect the caregiver from your end or the home health aide, maybe that they have something in common with someone at home so that they're getting the same kind of they have a relationship with the person or anything like that? Like, is there a way that you connect certain employees, to the client at home?
Sure, sure. So part of the intake process is we're asking specific questions. And truthfully, too, sometimes the families have an idea of what they would think works best.
Right.
And we put that in place, and then it may not work out because it's humans. It's human nature, it may not work out. So we take what we've learned from why it didn't work out, and it's not a criticism of anyone, and really do better next time. And say, you know what, they wanted somebody that is strong and has a strong personality to engage. And then you find out that no, that's not really how the patient doesn't respond well to that. They need somebody a little bit calmer, something that gives them a sense of ease, and then they'll engage. So we go through the information. Something that I frequently ask too, if you ask a family member, what time do you want services to begin? Because they're more in work mode. So they'll say,
Right.
I want it to start at 9 o'clock or 8 o'clock. Okay. What time does mom usually get up? 11. Well,
Right.
if I send an aide to the home at 9 a.m. and wake your mom up, I can pretty much guarantee she's not going to like her for no other reason than she woke
It's
her
super
up.
true.
So it's things of that nature,
Right.
looking at if the patient during the winter, if they're always cold in the morning, saying, come on, let's get up and take a shower first thing in the morning. That's probably not going to end well. So we try to have these delicate conversations that you automatically think, yep, get up early, get the day, let's get started, let's get moving. But that doesn't always work for somebody.
It's
A
so
2 o'clock
So true.
shower may be better. So
Hmm.
There's a lot of humanity in what you're doing.
Right,
Yeah.
right.
The client is really the one that, has to feel ultimately most comfortable, especially with ongoing services. And I think sometimes they're overlooked, not taken seriously. We talk about this on the radio show all the time. There's such a stigma on the aging population. And just because someone's sick doesn't mean that they're not cognitively 100% there. And even when they're not, there's still humanity involved. And the
Absolutely.
client is the reason that, you're there, and they're really like the most
And
important.
those little considerations, that was such a good point, really make or break things. I know with my own grandparents, it's really those little things that can totally, shape the situation. And it doesn't take that much, but it's working with them. It's not like, okay, get out of the bed, go shout. It's like not like this, overwhelmingly rushing process, which I think is so incredibly important.
Yeah, you're doing good stuff there.
We appreciate that. We're trying.
Well, we're just you're paving the way for a lot of these services, and it's important for people to understand also what their options are. And Northwell would be loved for it to be for everyone, but maybe it's not. But there are options out there when you're researching this, and for caregivers to hear all about these services. It's just, it's so important, for the caregiver too. Do you guys do anything? I don't know, probably not with Northwell Health at Home for caregivers. I know that you do a lot. There are other programs like that are out there, but.
Yeah, it's funny you mentioned that. Not funny, just appropriate because of the timing. So we have caregiver retreats, and we have one coming up, and I'm happy to share the information with you. We have one coming up in New Hyde Park in November, and also out in Riverhead, sponsored by Peconic Bay Medical Center. So the caregiver retreats really are designed to give caregivers the opportunity to come in, ask questions. We have a vendor fair where we invite other community providers, depending on what the common requests are. But people that provide in-home services. And, we offer a caregiver panel where we can, answer, questions. So I believe the Riverhead is going to be taking place at the Hotel Indigo on November 8th. And it's being sponsored by Peconic Bay Medical Center. So that day I know of. I think the New Hyde Park is actually a caregiver retreat for the Northwell employee population, because as you probably are aware, we're a pretty large health system. I think we have about 80,000 employees. So just dealing with the folks that are caregivers themselves and all of the challenges and questions that they have, we actually had set up an internal caregiver retreat just to, for the purpose of helping support their needs.
Right. We talk about this a lot, caregiver stuff, but the one thing that I'm always amazed at, and still to today, is Kristina and I talk this like almost every show we bring this up. When you meet someone, a spouse, who maybe the other spouse is homebound, has Parkinson's, some kind of thing where they can't get out, they're isolated, and every once in a while the wife or the husband get out, and you're like, well, you talk to them, as the primary caregiver, you have to take respite, you have to take care of themselves, and they're like, oh, I'm not the caregiver, I'm the spouse. I'm just, well, you're the caregiver. Like
you are the caregiver.
They have to identify, like those things, because there are services out there for caregivers and things like what you're doing, and respite, agencies that are providing respite. So do you find that people don't even really recognize that they are a caregiver, even though they are, but they don't really even identify as it, and they're doing everything?
Right. Well, and they say that it's the sandwich generation. So now you have, parents caring for their children, and also from their, for their parents or grandparents. And, they don't really identify themselves. Like you said, they don't identify them because, that's my mom or that's my son, and that's just what people do, and so they don't identify. But, we do as a health system acknowledge that the stress associated with becoming a caregiver or a caregiver for multiple people or generations is enormous, and it affects the health of those people. So, we want to make sure that we're being proactive as a health system to identify, those stressors and see what we can do to help. And a lot of times it's about connecting the caregiver or the patient to the resources. There's a lot of resources out there, like you mentioned, even just like the respite services. Many of the assisted livings offer some type of short stay program for respite care. There's a self-interest there, obviously, by giving someone a short stay at an assisted living, they might fall in love with the idea and say, I never want to go home again. So it's a good program for them. But it does give an opportunity for someone to, to have a break and to have, and to experience, like that, get out to go to a movie or get out and go on a vacation for a week. It's so important. So we do acknowledge that there are, there's plenty of work to be done in that space. And I think these caregiver retreats are just one, small example of how we're trying to identify that population of people.
With Project Independence, we find too, people call 311 for one thing, maybe transportation, and they're, having to, take their husband to a visit, and then, something, the mobility manager will hear something there that, maybe we can have a social worker help you out. Maybe it's an entitlement issue, maybe it's finding a physical therapist office closer to your house. Sometimes if you go to a doctor, they're just going to send to, whoever they use, and it's far away. Well, you don't have to go to that place. So, it's like, what we do. And that is so helpful for the caretaker too, because once they talk to us and they, like you said, they start to understand that there are resources out there for caretakers too.
Because it's what we always say, is you don't know what you need sometimes. You're like, I just need help. I don't really know the details. Like, so whatever's going to make, and that's so much of the calls. And I always tell people, I said, don't ever hesitate. Say, I don't know where to begin, and it's just taking that initial phone call to, have someone kind of walk you through all these things, and we've all seen it, play out in what we do. And I think that that's just the most important thing, is to have, education, and have you guys on this show, and just to educate people on these incredible services is just so important. Oh,
And
and that was
I
some timing, Dan. Were you very impressed with that rep? I didn't even
What
know
a way! I
Dan.
can't. So first, thank you both so much for joining us today.
you.
I know we'll definitely have you back, I know. And we'll be talking more about this because it is so important today, especially with the population, our aging population, and living longer, and the baby boomers, and just knowing that there are programs and services out there that are so helpful. So again, thank you so much for joining us. You're listening to Project Independence and Community Talk Radio on 88.1 FM and WCWP.org.